afternoon. This is Mandy Cohen. I'm the Secretary of Health and Human Services for North Carolina. I'm joined today by Mike Sperberry, Director of Emergency Management. Nicole Fox and Brian Tipton are our American Sign Language interpreters. And thank you, working behind the scenes, are our Spanish interpreters, Ron Vasquez and Jasmine Metavier. I'll start with a rundown of the numbers. As of this morning, we had cases in 79 counties. We're at 1,584 cases, and unfortunately up to 10 deaths. Most of our cases are in people who are ages 25 to 49. That's about 43%. However, most of our deaths, 78% of those deaths, are in people over 65. More than 26,000 tests have been completed across the many labs that are reporting to us. That's both the state lab and outside private and academic labs. And they do report their negatives and positives to us, but not all do. We have about another 5,000 we know are still in the queue waiting to be run at some of those labs. We know that 39% of our inpatient hospital beds are empty, and about 27% of our ICU beds are empty. And that's based about on 94% of our hospitals reporting and does not include our surge capacity. So as that's showing you, we have beds and ICU beds available. As I said yesterday, we have added this new data to the COVID-19 dashboard at ncdhhs.gov/coronavirus. I ask that you bear with us as there was so much interest in this new data that the server crashed. So we went ahead and posted that data as a document, as a stopgap measure, and we will continue to do that while we work on integrating it into the web page itself, but the data is there. So I know I've been getting a lot of questions from folks. Everyone wants to know, how long is this going to last? When is this virus going to peak? When can we resume our lives again? There's a lot of new modeling out there to try to help us answer some of these questions. Some of those models paint a rosier picture than others. We in North Carolina are working with a team of data scientists from our universities and private sectors, folks from Duke and UNC, Blue Cross Blue Shield, North Carolina, Novasci and RTI and others. And they're working to bring together several models, using different kinds of models, different data inputs that are more specific to North Carolina. They're looking at certain things specific to North Carolina, like the health of our population, the age of our community, and the density of how we live here in North Carolina. But as we look to any one of these models, I want to caution that modeling is not a crystal ball. It's only as good as the data we have at the moment that we can feed into it, and as good as the assumptions any one of those models makes. And all of this is so new. We don't have the perfect data, we don't know the perfect assumptions, and we aren't going to know with precision how things are going to play out. And it's human nature to want all the definitive answers. I know I do. And the one common answer that these models do give us, and that the published evidence to date do tell us, is that aggressive social distancing measures, like the one the governor put into effect that started this past Monday to stay at home, the data shows over and over that those types of interventions work to slow the spread of the virus. And that's the goal, right? To slow the spread of the virus so fewer people get sick at the same time. So as we work together to slow that spread of the virus, we're working aggressively as well to increase our capacity of our medical system. We're buying protective equipment, testing supplies, planning our surge for available medical beds, recruiting doctors and nurses and other clinicians to this fight. I know it's hard. I really thank you for staying home and saving lives. And before I turn it over to Mike Sperberry for more about our medical surge planning and supply efforts, let me remind folks that it's Census Day, hashtag Census Day, Make sure you're filling out your census form today. Be sure to be counted. Okay, with that, I will turn it over to Director Sprayberry.
Thank you, Dr. Cohen. Today is the day 23 of the State Emergency Operations Center activation for the COVID-19 response. 60 counties have their local emergency operations centers activated. 99 counties in the eastern band of the Cherokee Indians have declared local states of emergency. We've been getting a lot of questions about supplies coming in from the strategic national stockpile, so I want to address that again today. This week, we've been receiving our third shipment from the stockpile. We're still awaiting one final truck to arrive to complete that shipment. We expect that truck to arrive tonight. We have requested 500,000 of each of the following items from the national stockpile: N95 masks, procedure masks, gowns, gloves, face shields, and coveralls. I'll repeat the numbers that I provided 2 days ago. In the first two shipments, we received 38% of our N95 masks we requested, 91% of the procedure masks, 32% of gloves, 14% of gowns, 16% of face shields, and less than 1% of the coveralls. We'll provide an update to these numbers once the last part of that third shipment has been completely inventoried. We've already pushed out much of that third shipment to hospitals and medical providers. Our logistics and sourcing teams continue to find and buy additional personal protective equipment. Our orders so far are close to $100 million, but we have received very little of that. We're continuing to recruit, register, and screen disaster medical volunteers, including retired doctors, nurses, and other medical professionals. Nearly 1,900 people have registered online, and more than 700 have been vetted and are ready to work. These are medical professionals who can be assigned to hospitals and other medical facilities as needed to support medical surge. That's when hospitals open up additional beds after all the regular beds are filled. They can also be used to fill in for employees who might become sick. If you're a retired or former medical professional who would like to volunteer, you can register online at terms.ncem.org. Again, that's terms.ncem.org. I want to remind all North Carolinians to stay at home and to observe the social distancing guidelines. Please refrain from calling to report those who you don't think are following the rules. Call centers at the state and local levels, including 211 and 911, are receiving far too many calls from people wanting to report where social distancing is not being observed. Please stay at home, follow the guidelines, and encourage others in your community to follow them as well. Be kind and supportive to others. If we all do our best to stay home and maintain social distance, these calls won't be necessary. We also need to keep our 911 lines open for true emergencies. 211 is for people who need information or help with resources like food, utilities, and other human needs. For daily information updates on coronavirus, you don't have to call. Just text COVID-NC to 898-211. Again, COVID-NC 898-211, and you'll receive regular text updates. About 60,000 people are already receiving text. Many organizations are working hard to make sure people stay fed during the pandemic. Our state school systems are operating more than 1,100 feeding sites and serving more than 500,000 meals a day to kids. Food banks are seeing an increased demand and need for donations. This can be money or canned shelf-stable foods. To donate money online or to find a food bank near you, visit feedingthecarolinas.org. Again, feedingthecarolinas.org. A visit to a food bank to get or give food is not considered a violation of the stay-at-home order. And while you're staying at home, today, as the Secretary said, is a great day to participate in the 2020 census. It's Census Day. It only takes about 10 minutes to complete the online form at my2020census.gov. We also received some good news from FEMA yesterday for some Hurricane Florence victims. For about 90 families who are still living in FEMA travel trailers or manufactured homes after Hurricane Florence, they will not be required to start paying rent this month as that was originally scheduled. Due to the pandemic, FEMA has granted a 90-day waiver on those rent payments. Thank you for your support of the State Emergency Response Team. Your personal actions to stay home, stay distanced, and stop the spread will help save lives. With your help, we'll all get through this together. One team, one mission, one family.
Thanks, Director Sprayberry. We'll now turn over for your questions.
Gary Robertson with Associated Press. I had a question for Mike. He's done a lot of procurement, I'm sure, over the years, getting ready for hurricanes or during hurricanes. I'm sure this is something that is far and above what he has done in the past. Could you just talk about the struggles and the challenges that his agency, the emergency operations team has had in just acquiring these necessary supplies?
Thank you for the question, Gary. As you know, there's international, national, statewide, and local competition to get all of these medical supplies and equipment to respond adequately to the COVID-19 pandemic. We have had a difficult time finding vendors that can source our request. We're trying to make sure that the folks that are taking care of the folks in hospitals are getting those first. We've got a priority list. But having said that, we're still not getting enough. We're not even getting enough from the Strategic National Stockpile. But I can tell you that we are very persistent and we are relentless in seeking out resources. We anticipate that we're going to be getting some of those larger shipments, hopefully in the next couple of weeks. Again, we did get a good shipment from our SNS. It still wasn't what we wanted, but we'll continue to work hard and source all of those medical supplies and equipment that we so desperately need.
Hey, this is Elizabeth Ann from the Asheville Citizen-Times. Another question for Mike in the same vein. Last week you mentioned ongoing talks with manufacturing leaders in the state about the possibility of producing N95 masks and other necessary PPE. What's the progress on that front?
Right. We've been making some progress. There's a manufacturer out in the western part of the state who has banded together several textile companies. We think in the next few days that we might be able to start seeing some production lines starting that can produce gowns that will meet FDA requirements. We also know of some folks in Charlotte and some folks here in Raleigh that have shifted their production lines over to N95 respirators, and we've been working with our partners at our correction enterprise to begin to get things like disinfectant. So we're beginning to see a gradual shift of production lines in manufacturing, and we're working with our partners at the Department of Health and Human Services and other state agencies to really get everybody working on this together, because as you might imagine, here at Emergency Management, don't have a whole lot of folks that are really were experts in manufacturing, but we have gradually gathered together some folks, and we're making some good progress.
This question is for Dr. Cohen. Hi, it's Chandler Morgan from WVTV. Reports indicate that the CDC may soon encourage the general public to wear face masks. Has the state been looking into that possibility? And then why would that now provide protection, even though a few weeks ago we were told that they wouldn't help?
Thanks for that question about masks. What I would say first and foremost, you've been hearing about supply issues, and we want to make sure that we are getting that protective equipment for our healthcare workers first and foremost, right? They're on the front lines treating sick folks with COVID-19, and we want to be protecting them. And as we said, the supply lines are tight here, and so all masks really need to be going to our healthcare workers, our first responders, those that are working in our higher risk settings. Then as we think out to the future, when supply lines are better, I think we need to think about what masks can really help us do. I think they may be one element to add to the things we already know are tried and true things that work to stop the spread of the virus. Things we can do right now, like washing our hands. So when someone wears a mask, it is actually them protecting the world from them. It actually prevents you from having your germs get out into the world, which can be a good thing, but you have to couple that with washing your hands if you want to protect yourself. So we're never going to get away from this, our new normal of washing our hands, using disinfectant, wiping down surfaces. So that's going to be with us for quite some time.
Hi, Dr. Cohen. It's Andrea Blanford with ABC 11. I want to ask you about homelessness during the outbreak. If our homeless population can't access things like bathrooms and running water, then how can we expect this virus to affect them and then the community at large? And what do you think can be done to slow the spread among them? And can the state open other types of shelters for them right now? Would that even help? Thank you.
Yes, thanks, Andrea, for that question. And it is very much top of mind here, thinking about those in our communities who have unstable housing. So we are definitely working here in the state to come up with various types of housing plans, and then working with FEMA and other federal partners to get the funding and approvals needed to make that happen. We know there are a lot of community-based organizations and others who are already been doing this work. We have a terrific team that frankly has learned the hard way through some tough hurricanes about the importance of housing stability through times of crisis. So our teams are working hard on this issue. It's not easy. Housing is a hard issue in the best of times. And so we're working hard to make sure that we can find settings for folks to recover if they do have COVID-19 and ways to protect themselves. So thanks for the question.
Hi, my name is Kate Martin, and I'm with Carolina Public Press. Regarding the volunteers, how will the DEM know where to allocate these volunteers? I'm wondering if they're going to be deployed based on where the volunteers live or where they're needed most, and how are you going to know where they're actually needed?
I'll start, and then Director Sprayberry may want to add more, but great question. Right now, we're just wanting to understand who might be available. And then as we work on our medical capacity planning, we're going to have to be pretty flexible. We're going to want to move folks where they're most needed, obviously, where there are places where we might need to have those with the right skills match up to where the need is. And that's this big overall state planning effort that we're doing right now. We know that some of our clinicians may need some amount of training. They may have been trained to, and it's been quite some time since they've done inpatient hospital medicine. They're used to working in the outpatient setting. Want to make sure we're thinking about all of those things as well. And then I know Director Sprayberry's team is thinking about how do we move people around the state. Obviously, we'd like to do it as close to their home as possible, but we know we might need to move people around the state if that's what our needs are at the time. Director Sprayberry, anything to add?
Yes, ma'am. So I think that, first of all, with medical volunteers, they're being well vetted, and then they're being placed what we would call into staging and ready to deploy when we need them. But really what I'm going to be doing is depending on my technical partners, DHHS, to let me know where they're needed. And my anticipation and our planning factor for this is that we would anticipate that we would integrate these volunteers into already established hospitals and other places of medical care so that they wouldn't have to worry about going to a place by themselves. They'd be right there and they would be integrated into a team. So we're very excited and proud that we have so many volunteers, and I think that that would be the way we would implement it. We would integrate them in with already established healthcare organizations throughout the state on an as-needed basis.
To please put yourself on mute after you ask your question. Thanks so much. You there? You're breaking up a bit. Oop.
Yes, this is David Ivy with Spectrum News. I'm in Fayetteville right now, and later this evening, a curfew is going to go into effect for the city. What I'd ask probably Secretary Cohen, what do you think about that measure, and is that something that other municipalities throughout the state at some point?
Again, I'm going to ask folks to make sure to put themselves on mute while others are asking questions. But I think the question was about curfews, and is that something that we are looking at for the state? So what I would say is we are all looking at efforts that are going to slow the spread of this virus. Slowing the spread of this virus is going to save lives. As you know, the governor's order to stay at home just went into effect on Monday evening. We want to make sure that folks are fully complying with this order. We fully respect and support local communities going further than the governor's order in order to keep their communities doing as much social distancing as possible. So we support those activities. And we will continue to look at options to see if we need to do further social distancing. We'll continue to look at our case counts and our hospitalizations and our strain on our medical system and learn from other places around the country to understand what is working and what might need to be changed as we go forward here. But right now, we're focused on implementing the governor's executive order from Monday, which is a stay-at-home order. Again, public schools closed, mass gatherings closed, restaurants and bars only open for takeout only. Folks should be not having any gatherings larger than 10 and really focusing on staying at home. Unless you're going to the grocery store, seeking medical care, picking up your medications, folks need to be staying at home as much as possible. Obviously, if you work in an essential business like healthcare or our utilities or our grocers, we know you have to go out to work as well. In those circumstances, we want folks to be as careful as possible. Continue to do those important things about washing your hands. It works. The data tells us washing your hands, washing down surfaces, that works. So thank you for all you are doing out there to comply with this. It does save lives.
Hi, this is Jason DeBruin with North Carolina Public Radio. I know one of the choke points to getting more testing done was not having enough of the PPE. I wonder with some of that coming in, if that will free up some more testing capacity in the near future, and also with some other private tests coming online, if you might see some ramping up in COVID-19 testing here in the near future.
Thanks for the question, Jason. Yes, testing continues to be a very important component of us fighting COVID-19. We want to prioritize testing for those folks who are in hospitals, in long-term care facilities, and in other places where outbreaks and the spread of the virus can be rapid. So we are definitely targeting our testing there, again, trying to prioritize both our resources and our testing capacity. I do think testing and ramping up our testing capacity continues to be an important focus for us. We need partners at the federal government, in the private sector, to continue to work with us on that. We do see multiple new modalities for testing that have come out, some more rapid testing. I think all of that is positive news in the right direction. We want to make sure these tests are though also high quality tests that can actually detect COVID-19. We don't want tests that miss the COVID-19 and we have people who think they're negative but actually have COVID-19. So want to make sure the tests are working well and that they have good throughput. Some of these new faster methods, they only do one at a time. So that might be good for smaller places or doctors' offices, but our bigger labs do hundreds of samples at a time, though it may take a number of hours to run them. So I think it's going to take a whole range of techniques that we'll need to ramp up over this period of time in order to, again, do the testing that we want. I'm hoping that we have more success at different ways of collecting samples that uses less of the protective equipment that we know is in short supply. So I know our scientists are working hard on this, and we want to support as much of that work as possible, and work with our federal partners and our private lab partners, our academic partners as they ramp up.
Yeah, Dr. Cohen, this is Rick Curl with the Daily Record and Dunn. Going back to with the question on the CDC's possibility of having people wear face masks. What about the effectiveness of homemade masks? For people, I've seen it's being used elsewhere. What's the effectiveness of a homemade mask, and is that a viable possibility?
Thanks for the question. Again, if you can mute your phone. So the question was about the viability of a homemade mask. So as you look at the data around masks, it's mixed. What I would say is masks are always going to need to be used in combination with the tried and true measures of washing your hands. And then there are different materials that masks can come in. There are certain materials that have natural antiviral, antibacterial kinds of properties versus other kinds of materials that may be more porous. So homemade masks, again, are going to be variable in terms of their ability to block your droplets from getting into the world. Again, masks are protecting the world from you. It's not really protecting you from the world. But I think there is a place for masks once we make sure that all of our healthcare workers have the masks that they need so that they are protected. So that's certainly Director Sprayberry and my focus right now, is that we're scouring the world to make sure we have the supplies for our frontline healthcare workers and our first-line responders for all the work they're doing. And then let me just end the press conference in thanking them for all the work that they're doing out there. They're the heroes on the front lines here. So thank you. Know that we're working for you to protect you all the time. Thanks for all that you're doing. Thanks for the time today. And again, check out ncdhhs.gov/coronavirus for the latest information. Text COVID-NC to 898-211 for more information. And again, it's Census Day. Be counted. Thank you. Stay well.